Hello everyone, it's me Dr. Ayaz Ahmed. I am working as an aesthetic dermatologist. Today I have selected another important topic for you. The name of topic is varigate porphyrias. Hopefully you will learn and subscribe my YouTube channel. Definition: it is a rare inherited autoimmune disease characterized by photosensitivity induced skin fragility and blistering lesion, which may cause acute attack. Introduction, epidemiology and pathophysiology. It's an autosomal dominant disorder due to deficiency of inherited protoporphyrin oxidase enzyme. It leads to photosensitivity and inhibition of BPG deaminase, causing acute attack. It's so common in South Africa. Prevalence in white and non-white people over there is about 1 is to 200. The incidence is about 0.01 to 0.26 new cases per million per year, and prevalence is about 0.5 to 1 per million. 80% cases of varigate porphyria are asymptomatic carrier in South Africa. Clinical features. As we know that the porphyrias are metabolic disorder characterized by photosensitivity reaction when these patients are exposed to sunlight. So the clinical features here in case of varigate porphyria are also due to photosensitivity induced. 70% cases have tetanus involvement and 17% people presents with acute attacks. It usually begins in adolescence and adulthood. Skin fragility on exposed part of back of hand is commonly noticed. Other features are painful tense blisters with scarring, hypo and hyperpigmentation of skin, pseudosclerodermic changes in hand and fingers, photoonycholysis and mild hypertrichosis are noted. Mild abdominal pain, bulbar palsy and respiratory paralysis are also seen. This picture describes clinical features of varigate porphyria. You know, hand and back of fingers are involved here in case of varigate porphyria. You can see there are lots of erosive lesion with blisters on the back of hand, onycholysis of nail and pseudosclerodermic changes of skin of hand and finger are noted here. Differential diagnosis. Differential diagnoses include blistering disorders, porphyria cutanea tarda, especially late onset, congenital erythropoietic porphyria, hereditary coproporphyria, and pseudoporphyria are differential diagnoses. Investigation. Investigation series include number first plasma spectrometry, which is usually noted at 626 nanometer. Persistent normal level of fecal protoporphyrin concentration in adult with genetic defect is prognostic marker of varigate porphyria. Increased level of coproporphyrin in urine and coproporphyrin and protoporphyrin in feces is another investigation of choice. Increased BPG and ALA during acute attacks are seen. Management. So all the porphyria, they do have some general management which include protection of sunlight by using cloth hats and gloves. Also, use of sunscreen containing zinc oxide, titanium oxide, iron oxides are best to avoid solar and beta light. Filter film for car, window and homes are used. Beta carotene and canthaxanthine have some limited protection. UVB phototherapy and list of drugs to avoid, because most of the drugs are involved in varigate porphyria. The patient must know which drug is causing damage to his skin. Also, wear of emergency identification bracelet is also mandatory here in case of varigate porphyria. Thank you very much. Stay connected and subscribe my YouTube channel.